the right technology, the right operation, the right people, the right PT, the right everything, then you can achieve more than what you thought you can.
Others can do the same thing. So if there's anybody else out there that got a physical disability of some type, there's always something that can be done. You just have to search for the right tools and talk to the right people, and don't give up on your dreams. That's just, you don't have to do that.
The surgery isn't the end of something, it's the beginning of something new and positive. Once you have the solution, and I know I have the solution, that's what you look towards, the future. Before this, I was limping, walking my dog. Nobody should be doing that in their 50s, and nobody should accept that that's their lot. Because there are solutions, and the proof is here.
In fact, we have patients now running triathlons and marathons, climbing mountains, skiing 100 days a year on their replaced parts inside their knee. And so my opinion is that given current new techniques using robotic accuracy, eliminating cement for the total knees, patients can return to full sports as long as they do their fitness and rehab program and follow our advice.